I would request Sri to talk about our work at REAN Foundation and the vision for thalassemia um, uh, in general.
Thank you, Santosh. Yeah, please move on to the next slide. Hi, I'm Sri Vasireddy with the REAN Foundation. The mission of REAN Foundation is to provide accessible and affordable solutions in local languages at the convenience of their homes and embedded into the lifestyle. So that means a lot. I'll break that down further. When we talk about access to care or inequity in access to care in public health, I would say about 80% of that is gone into providing access to a doctor, providing access to a patient, to a doctor. But what if in this particular case, I don't know why I am weak and I don't know that, I may be having thalassemia. So how do we provide awareness to seek access to care? And then once we get to that point, how do I adhere to my advice? In this case, it is continuous checking of anemia or continuous management of blood transfusion. So the purpose of REAN Foundation is to provide the patients of particular health conditions to adhere to the advice of their doctors. So we do that by providing this platform that is completely free and open source. And thalassemia is not the only condition. I'll talk about some other conditions that we already work with. So what it comes down to on the left-hand side, bottom, if you see, the conditions come down to managing their vitals, symptoms, medications, mental health, physical health, and nutrition. So these 6 areas of management will further need to be broken down into a schedule. So daily messages, if I'm talking about maternity care, I may ask somebody to take their weight on a particular day, suggest nutrition advice on a particular day, check their anemia, because anemia is a risk for maternity care as well. So how can we make it, broken down like that, convenient for people to consume in their own local languages? And if they can afford to wear wearables, we can take some of those readings without them having to go through the pain of, taking these readings. So by providing this underlying framework, we have been able to build solutions in maternity care, mental health, cardiovascular health, and we have the American Heart Association using it for cardiovascular health in the US. We've just started working with NCDI Poverty Network, which is a WHO, UNICEF, and Harvard network based in Africa to treat rare diseases. We work with Dayananda Medical College in Ludhiana for maternity care, LB Prasad Eye Institute for eye care, and Manipur government just released our bot for mental health. Next slide, please. So this is a good example of what we mean by convenient, way of providing care. Oh, I don't know what. Can you please play the? Yeah, so just simply in WhatsApp, by sending a picture of your conjunctiva, we can give you some indication of what your anemia, are you anemic or not. So the idea here is not that this is a conclusive test by any means. It's just a convenient way of finding out whether you should go get that test done at a location where Gazelle is available for that, for example. This is the screening. And the next slide, please. Now, this is the management piece. If you remember, we talked about managing involves making sure that you're going through transfusions. And it's a pain for a parent to remember when a patient, when a child needs to go through this transfusion. So we send reminders when their transfusion is due. And when they accept that reminder, we look within a pool of donors that have donated to that individual in the past and coordinate with those donors as to who is available at the time and at the location that this individual is ready to go through transfusion. And we send a message, WhatsApp message, telling both of them to meet at a certain place at a certain time. And this Blood Warriors is one of our partners that is using this actively in India. Right. So next slide, please. So these are very quick examples in the thalassemia space as to how we make it very convenient. As I said, everything that we build is free in service, very easily accessible through WhatsApp, or our hope is to make it even more convenient going forward. And the entire stack is open sourced on GitHub, not just for thalassemia, but for all other conditions that I talked about that we help manage. So please feel free to use it, whether your intention is for profit or non-profit. For you, it is free. Okay. All right. Thank you.